AM 1060 WMEL.
AM 1060 WMEL, your home for the Florida State Seminoles.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. Our show is designed to educate, inform, and connect those that care for seniors and seniors with resources in Brevard County. Some of our sponsors include Kindred at Home Health, formerly the Gentiva Home Health Care Organization, the Eye Institute, Dr. Lee Sheldon, Bill Johnson, elder law attorney, this radio station, WMEL AM 1060, Wistoff Hospital Systems, 11 Home Care, Atlantic Shores Rehabilitation, Ebony News Today, Wendy Handy of the Dale Sorensen Real Estate, and Ear Care Audiologist, and Handy Pro of the Space Coast. And I'm going to be doing a television show next week with Handy Pro of the Space Coast, and it's quite different, folks. The people for doing rehab and home work around the house have changed, and the lady that runs the Handy Pro of the Space Coast was a former engineer out at Space Coast, and when they downsized, she just decided she was going to take her expertise and use it for changing the way people try to live in their homes as they got older, just to make it easier. And I really admired her. I had her on a radio show, and she was tremendously informative on what she did. Dr. Sheldon is going to be my guest for the show today, but he was wrapping up with a patient, and he was a little bit later joining us, just so that most people know. Bill Johnson, the elder law attorney, is always very, very good about sending me the National Association of Elder Law Attorney bulletins every week, and I read them, and I pick up a lot of good information. And one I picked up this time was titled "Hospice Fraud." And for those of you that are listening to me today, consider the number of you that might have had hospice care come into your home. I just want to let you know that last year alone, the federal government prosecuted 60 cases alone, 1 year, of hundreds of millions of dollars nationwide going into hospice fraud. And, there was a reform in how Medicare pays hospice providers. It went into effect in January, but it's not going to do very much to curb such abuse. And this is what the experts say. So we'll just have to see how it's going to work. But Medicare began huge payments to better reflect the cost of care. And the first reimbursement charge, folks, so you know how long this has been going on, goes all the way back to 1983. That's a long, long time. You got Daniel on yet?
No, I'm here, Joe. Am I a good substitute?
Yeah, yay. So I'm going to talk to you long distance then.
That's right.
That's all right. It's just as well to have you long distance, because with all those cigar smoke you smell, you always think up the studio here.
Now you're really killing my reputation.
Right. Don't you smoke cigars?
No.
Well,
I've never smoked a cigar in my life.
It makes a good story.
You're right.
Yeah. But if you're going to become a cigar smoker, you really need to smoke what they call rum-soaked crooks. And everybody that's listening that's ever smoked a cigar, a rum-soaked crook is the cheapest cigar there is, and it's also one of the worst cigars there ever is. I've never been a cigar smoker in my life. My wife has said, "Joe, what are you talking about?" But, as long as you're not in a booth with me, it's easier to make a statement about you. I know you don't smoke at all.
Yeah, you're right.
I know that. I knew that, too, and I was kidding you.
I hate to disappoint you.
But it makes a good story.
It does.
And what it does, sometimes...
But am I going to read, by the way, am I going to read about this in Hometown News? It's revealed on Helping Seniors in Brevard County on WMEL that, in fact, Dr. Lee Sheldon secretly smokes cigars. Am I going to see that in the headlines?
You got to talk slower. I'm only kidding.
I don't know how to talk slower.
Let's what we really wanted to talk about. We can talk about whether you're in your office talking to me, and this happens, folks. This is really one of the beauties of talk radio. I can talk to Dr. Sheldon any place in the world as long as he can get to a phone line. Right, Lee?
You got it.
That's important. What's more important is getting out the types of information that we can do on talk radio. That I have some other papers today that just shoot the heck out of the fact that they think that older people don't get involved in new technology, such as the Internet, Facebook, Twitter, because the statistics show that in the last 3 years, the numbers of seniors doing these things is up 150%.
Wow.
That's staggering. But what it shows me that if we can put out good information on our radio show, that the people that listen will profit by it. I think that's important. So what we really wanted to talk about today was we titled it, folks, The Dental Experience. And we've come a long way, Lee, in performance of dentistry. You've published a couple of books, and you've started so many things trying to bring to light the importance of periodontal care. But what would you say, Dr. Lee Sheldon, about how far we have come?
Well, I think if we're going, and I meet so many patients, Joe. I meet so many patients who had bad childhood experiences, and as a result of that, they are afraid to go to the dentist as an adult. And these experiences, you think they're going to fade away, but I bet you there are some listeners right now who are saying, "Yeah, I've stayed away from the dentist because, boy, that experience is so bad, I just can't walk into a dental office." And I see lots of those types of patients who just can't walk in. They finally have so much need that they know there's no way out, that they have to see a dentist in order to be able to get the problems taken care of, because there's only so long you can have not only discolored teeth, but infected teeth before it affects the entire body. And so they have to make that decision to come in. And it's such a problem that you have a whole subspecialty of dentistry that's growing up now to treat the fearful patient.
I imagine, Lee, that many people today, going back and thinking about the experiences they had with the way the drill was manipulated with the treadle machine. A lot of times the doctor was pedaling the treadle on the floor and making the drill turn. I can remember that, and
yep.
It wasn't the high-speed stuff you have today, the stuff you can hold in your hands so easily. The people don't see they don't see a lot of things that are happening. Dentistry today is so different than it was when I was a young boy, and go ahead.
Well, just think of the way it was when I was a kid, and I'm a few years younger than you are. And that was, I would go into the dental office, or people of my age would go into the dental office, and the dentist would ask, "Do you want local anesthetic? I'll give it to you, but it costs $5 extra." Did you ever hear of that before?
No, I never heard that.
So, if it's $5 extra and you're on a budget, then the mother says, "No, you've got the high-speed drill," and this is the time of high-speed drills, not in the the treadle days that you're talking about. And so the drilling would occur because the idea was, you're using a high-speed drill, it doesn't vibrate, and so therefore it's not going to hurt. And that is not true. That's not true at all. Once you go through the enamel and you go into the dentin of the tooth is highly sensitized, and you feel pain. So parents on a budget would say, all right, my understanding is that it's not going to hurt. I won't pay the extra $5 for local anesthetic. The whole group of patients grows up saying, all right, dentistry hurts, even despite the high-speed drill.
But I think today, and all my experience, Lee, from juvenile fillings to then going into the Navy and going to, I want to call it production type dentistry, and then as I became older, and I encountered different dentists in civilian practices when I was stationed in different places, I saw there was a great change. And then when I retired, and then the association with you over the years, I've watched what you've done in your practice, and having watched you and then experienced the types of surgery, the things that you can do, I saw a whole new world. The thing that worries me more is that we invest so much in this country in Medicare to fix a broken bone or to fix something in a body, but Medicare completely ignores the mouth, and I just wonder why the dental associations or the dentists did not try to oppose or force or do something to get Medicare to include dentistry. Why not, Lee?
As a matter of fact, that's been done over the years. Absolutely, it has been done. And essentially, if Medicare doesn't have to pay, or if the government doesn't have to pay, that means that that there's less government funding that's necessary. If people who really needed a lot of dental care, and there are a lot of people in this county and in this country who need a lot of dental care, if dental care were covered the same way medical care is covered, it would be a tremendous. I wish I had the numbers in front of me because I wasn't prepared to talk about numbers, but it would be a tremendous additional burden on the taxpayer in order to be able to fund the amount of dentistry that's necessary. If you look in the areas in the countries where socialized dentistry is there, where the government does pay for it, number one, is very expensive. Number two, the services that are covered are dentures and extractions, maybe some fillings on a kid, but that's about it. And so over the years, those people who said, all right, I'm going to get what the government pays for, had a lot of extractions and dentures done. The same dentists who were doing the extractions and dentures during the day under the government health plan would have their own private clinics at night, and then would be able to do the services that a lot of patients wanted. So that even though government funded a certain level of dental care, the demand is different. The demand is for saving teeth. The demand is for braces, dental implants, crowns, bridges, all those things. Even where governments pay for health care, for dental care, still patients were paying out of their pockets of the dental care they really wanted.
So what you're saying is all these countries that say they're doing all this, they're doing a certain level, up to a certain level, and then after that it's still private pay.
That's correct.
A lot of people don't realize that, Lee.
Yeah.
They think that all this stuff should be happening. But, you go back to the old thing that I know there are specialties in dentistry, just as there are specialties in the practice of any kind of medicine. But in working with senior citizens over the years, I have found a number of people that needed care that if we tried hard enough and worked hard enough with different people, we were able to, in most cases, get the care that these people needed. But when somebody is in agony, like on the weekend, what happens when the dental offices close on Friday night at 5 o'clock, what the heck? You can get severe toothaches and be in tremendous pain on Saturday and Sunday. What do these people do?
Well, the key element is to establish a relationship with the dentist.
Yeah.
Make sure you're getting regular dental care done, and you have a relationship with the dentist, because if you get in trouble over the weekend, that dentist will see you.
Well, I guess you're right, exactly right, because the two dentists that have taken care of me most over the number of years I've retired in Berry County, you and Dr. Mason have given me your cell numbers, so if I have a problem, I know what I can do. But I'm fortunate, and most people don't have that. And if they go to an emergency room, emergency rooms have no service, or do they?
No, they have no dental services whatsoever. There are times that there will be a dentist on call, but usually what will happen in an emergency room is that you will get pain medication, you'll get antibiotics if necessary, and then be asked to see the dentist on a regular weekday. The people who go into emergency rooms, for the most part, are patients who don't have a regular dentist, so they have no relationship. They're looking for a way out, and so they'll go into emergency rooms, so they'll go into walk-in medical clinics or that type of thing in order to be able to be attended to for the emergency. They'll still need to find a dentist later on, because none of these facilities, at least in this county, have dental facilities when they're within the hospitals or within the clinics.
Yeah, I know that to be a true fact. But I guess what you're saying is that these urgent care clinics and emergency rooms could prescribe depending on the type of pain that emergency room doctor or urgent care doctor saw that the patient was having, they could prescribe some kind of a drug to help alleviate the pain, right?
You can. Unfortunately, and I've got to tell you, we're hitting the other end, and this is being publicized more and more and more, and you're going to see it more and more and more. There are a number of patients who will abuse the system in order to be able to get drugs. In other words, they have a cavity, they'll nurture that cavity, not get it fixed, but will nurture that cavity so when they go into the emergency room, they can point to the cavity and say, see, this hurts, give me the drugs. And then they get the drugs, and they're told to go see a dentist on the following day or the following weekday, and they never do come in. And so it is a way of it is a method of drug abuse by nurturing cavities. So if you're looking at the people who really want to take care of themselves, really, Joe, there is no substitute for a good dental examination.
I agree.
To prevent all of these problems from occurring in the first place.
So what you're saying is another reason why they're getting ready to pass a law that the legislators are working on it, to say that if you get drugs, you have to get all your drugs at the same pharmacy. In other words, if you prescribed pain medication for a person, they'd have to get, if they were going, let's just say, going to a certain CVS pharmacy or the CVS system, that's the only system you could write a pain medication for those people.
Yeah, that would make sense. And frankly, cooperative relationships among the pharmacies could be done very easily, I'm sure, by, with electronic records the way they are now. That's one side of it. Of course, the other side of it is that we don't want to be able to share information because these are supposedly private records. So, if we're talking about the person who's going to abuse the system, unfortunately, they're going to find a way of abusing the system no matter what.
And that just hurts other people, Lee.
Pardon me?
It just hurts other people.
Oh, of course it does. I mean, the time, the expense, and I'm sure you've handled this on other shows. The expense to society for a drug-addicted individual to be taken care of, either when they're trying to get better, and that's usually privately paid for, but while they're abusing the system, is extremely high, because once you walk into a hospital emergency room, the hospital has to take care of you, and there's expenses involved in taking care of that person. Whether those expenses are passed on to the government or whether they're passed on to other paying patients, the expenses have to be covered some way.
Okay, we got about 2 minutes to the break. I don't want to get started on my next question because I am going to get back to the dental part of it because it's today's show. But you're on the subject of medications, and I know over the years you've got some very, very strong beliefs about the uses of medication, how people should try to control their own immediate use of drugs. Can you just wax about a minute and a half on that?
Yeah, I mean, when most of these medications were developed, I'm talking about medications for the commonly used medications, those that were developed for high blood pressure, those were developed for cholesterol, even those that were developed for osteoporosis, although let's put the osteoporosis in a separate category. Let's just say high blood pressure, and let's talk about cholesterol. When these were developed, they were developed for the people who had severe cholesterol problems and severe high blood pressure. Over the years, it's become more commonplace that everybody's on a blood pressure drug and everybody's on a cholesterol-lowering drug. The purpose of these medications is to get you out of the emergency of having high cholesterol or high blood pressure, and then to change your lifestyle so you don't need the drugs again.
Oh, it makes a difference. Okay, we're getting this thing. We're going to wind it down. We're going to take our mid-show break, Lee. But when we come back, the first question I want to get to is good and bad dentist. And let's just pick up from there on what you and I really were going to talk about, okay?
Okay.
All right. Stay with us, folks. We're going to take a short break. We'll be back in about 2.5 minutes. But Dr. Sheldon's got some interesting things to say about sedation and dental practices. Stay with us.
AM 1060 WMEL, the Talk to Me station.
This is Joe Steckler, folks. Back live with the second half of the show with Dr. Sheldon. I want to quickly mention my sponsors, and the phone number to call Kay at the office is 473-7770, 473-7770, 473-7770. The sponsors for the second part of the show include Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney of the Brownsville Financial Team, Barbara McIntyre, Home Equity Specialist, Canadian Meds of Melbourne, Vitas Hospice, and one more minute. I got them all. That's it. Let's get back to the show. Dr. Lee, you there with me?
I am here, Joe.
Okay. Let's talk about what you and I want to talk about. Let's talk about good dentist versus bad dentist.
Yeah, and you know, you don't want to cast aspersions upon anybody. Anybody can have a bad experience. Anybody can have a bad day. Anybody can have a bad anything. And
right.
And by the way, anybody can have a personality conflict with anybody else. So let's look at that, and let's make sure that we're looking at that carefully when we're choosing a dentist. Fortunately, we have the opportunity in this county to be able to choose among over 200 dentists that you can see, you know, of different specialties, and most of them are general dentists, and you can do very well and get very good dentistry done. And there are times when you're going to see somebody and the result isn't what you would like it to be. The first thing that happens, or that you should do, is go back to that dentist and express dissatisfaction if, in fact, that occurs. It's interesting, when you're in private practice, there's a certain onus upon you in order to be able to make your business run properly. And part of your business running properly is to have satisfied patients. Dissatisfied patients these days it's tough because, number one, the reputation spreads. Number two, people use online review services and express that dissatisfaction. So every dentist, or nearly every dentist, wants to do everything that he or she can to make sure that our patients are satisfied.
I think a lot of it has to do with the patient, too, Lee.
It does. It does. And frankly, I just experienced that yesterday, where I had a patient who was really totally unreasonable with expectations based on the things that he wanted and the requirements that he had. And so, yeah, there's a certain level of communication skill that you need in order to be able to communicate with that patient properly. And thank God the patient's wife was there, too. And after we got all done, the wife and the patient went to the car, and she apparently said, "Just a second," and walked in and told my staff, my office manager, to thank me for what I did. Because essentially I spent an extra hour explaining what was explained initially anyway, and whether the person was cantankerous, rambunctious, was upset for whatever reason, and I'm sure in his mind there were reasons. You do have to take the time to explain things so that it is good. And I was so happy the wife was there, because the wife could then see what was done, was able to look at the x-rays and the CT scan with me, was able to look at the clinical result, was able to look at everything and say, all right, I understand what he's doing and why he had to do it that way, and it just made it a lot easier. But the last thing I would want to do would to leave a patient like that out in the cold and say, well, sorry, that's the best I can do, to see you later. So we took the time to be able to explain it properly so that we have a patient that's happy, or as happy as he is capable of being.
Yeah, the other part of that equation, Lee, is that, if a person has a severe mouth problem, an ache, or a pain in their body, the person that is experiencing that pain knows what it feels like to that person. A doctor, a husband, a wife, other people, sometimes they don't understand what their partner or the other person they're treating or talking to is going through, because sometimes pain is so intense that it can actually make you think or do something that you don't want to do.
Oh, that's absolutely true. That's absolutely true, and that's why it's so good that when I welcome it. I love it when a patient comes in for their initial examination that they brought somebody else with them, so somebody who is not in pain can, number one, see what the problem is and look at it more objectively, and then be able to reassure the patient that everything's going to be okay.
Okay. Now, with the new dental techniques and all the stuff that we talked about in the first part of the show, can dentistry today be performed without sedation or medication?
Oh, it absolutely can. Now, understand that in our practice we do a lot of sedation. I'm not recommending it, and frankly, I get very upset when people are advertising sleep dentistry and everybody can go to sleep or take a pill or whatever it is and everything will be all right. Because these drugs, as you know, have their side effects, and there's memory loss associated with these drugs. And frankly, I think on one side we're way too willing to prescribe drugs in order to supposedly make the dental experience better, or breathe nitrous oxide in order to be able to make the dental experience better. The dental experience is such that most patients can be very, very comfortable. You find somebody who knows how to give a good injection, and we'll talk about that if you'd like to know how to give injection. I will give you that secret. And most people can do well. And for those patients who need sedation, well, yes. I mean, sedation is available. There is a special level of training in order to do conscious sedation. And then there are even anesthesiologists who travel from office to office. We have an anesthesiologist in our office, at least once a week, putting our patients to sleep. But, part of that is because we do such big procedures, they want to be asleep, and I don't blame them. But the goal always is to take a patient who feels that he or she needs sedation and be able to make the experience so good that after the patient has been in the office for a while, the patient is used to the office, understands that the staff is there to be able to help them, and that they can confront the situation awake rather than asleep. And while there are some people who just have to be sedated every single time, for the most part, we're able to get those patients who need sedation to the point where they can be in the office, comfortable, needing only local anesthetic, nothing else.
Okay. You mentioned giving shots, and somebody asked me a question one time, and they asked me a question, I put it to me this way: why do dentists have to wiggle and twist your gums and your jaw when you give a shot? Why do you do that?
Well, yeah, and it's a distraction technique, and I used to do it. I don't do it anymore. But supposedly it's a distraction technique, so if you're pulling on the lip, you don't feel the needle piercing the area where the needle is going in.
So they did it with the theory that they wouldn't feel the needle as much?
Yeah, they feel the wiggling of the lip, and they don't feel the needle instead.
Okay, you gave me shots, and I have to tell you, I don't even remember feeling the shot, but I don't remember you doing anything other than giving me the shot. You didn't do anything to distract me, did you?
No, but let's talk about the way I give a shot, because the way you give a shot is important. There are two different types of discomfort that you're going to feel when a shot is given. The first type of discomfort is going to be the discomfort of the needle penetrating the tissue. And that's when it penetrates the surface of the tissue. So that's number one. The second type of discomfort you're going to feel is as the fluid is being expressed through the syringe. In other words, as the shot is being given, there's pressure and some pain associated with that shot, particularly if the shot is given too fast. The faster that we inject, the more the tissue stretches. Tissue stretches faster. It can't accommodate the fluid, and people feel pain. And so, therefore, our goal in giving an injection is to, number one, remove the feeling of the piercing, and then, number two, remove the feeling of the pressure. So the way you get rid of the feeling of the piercing is two. Number one, you use a topical anesthetic, that jelly that tastes like mint or cherry or pina colada. There's a number of different flavors. And that does that somewhat removes the feeling of the piercing. But you may still feel a little bit. The next step in giving the injection is to pierce just the surface of the tissue and give a 1-second injection. Most people can tolerate the discomfort for 1 second. And when we give just a little bit of fluid after we pierce the tissue, that local anesthetic that we've given will then start to get that piercing area numb. Once that area is numb, then we can inject through that numb area and complete our injection as long as we give it very slowly.
It makes a lot of sense.
The most uncomfortable injection is the injection on the roof of the mouth. And people can't stand the injection on the roof of the mouth. Why? Because we do the piercing motion and we inject all at one time. And my suggestion, and certainly what I've taught my doctors, is when you give that injection, you give it exactly the same way as any other place. You give a 1-second injection, let that work. Wait a minute or two, give a second injection, but don't do the complete injection. Inject a little bit more fluid so the patient doesn't feel it, but the more fluid you put in, the wider the numb area will be. And then wait another couple of minutes, and then give the third injection from the same spot, and the patient doesn't feel it. You just have to build, just a little bit at a time. Don't rush it, and you can make nearly every injection painless.
And also, I think one thing that many patients might not think about is that by sedating or injecting whatever you use, the dentist can do a better job if the dentist doesn't have to worry about the patient's anxiety. Does that make sense to you, too?
It does. I mean, and so there's a number of different ways in which we want to help patients with anxiety, and it isn't only medication. Certainly it's the reassurance of the staff. It's having a room that's calm. It's having an office that's calm, so that people walk in and have an office without smells, by the way, the typical dental smell. So that when people walk into the office, it doesn't re-stimulate a previous bad experience.
Is that
what you do? That you can take a number of people who are anxious, and they get the anxiety. But don't forget, the anxiety is based on a previous experience. If they can get through or can confront the anxiety they're having in this experience, and think about this experience only, and see how this experience is better, then maybe that anxiety will go away. And I can't tell you how many patients where that's actually occurred. The patient came in, was reliving some bad experiences, and so thought that experience would be the same experience as in my office, and then we give them a good experience. The patient does fine and isn't as anxious the second time or the third time or the fourth time, and can get through it very easily.
Is that kind of what you mean by setting the tone in your office?
Absolutely. Yeah. Notice when you walk into my office, it is a rule that everybody be calm and enthusiastic. Everybody is laughing. Everybody is having a good time. If we can't do that in the dental office, number one, we as doctors and staff are going to have a bad experience. Imagine walking around with a scowl on your face all day. And the patients pick up on that tone and want to be associated with that tone level, because that tone level is a higher tone level maybe than they experience anyplace else. So it isn't unusual when patients will walk into our office saying, I really like coming here. I'm going to miss coming back here because I have such a good time while I'm here.
And the other thing that you could do to set that tone in your office is the people watch the endless loop tapes of our TV shows, which you show. If you would provide popcorn, it's kind of like being, you always give everybody a toothbrush, and they could brush your teeth and get rid of the popcorn, but you would have a whole different thing, because I think you do a smart thing. What Dr. Sheldon does, folks, is all the TV shows that we've shot over the years, he plays these things in his office, and there's a big TV screen up there. And I was over there one day. I was waiting. I was getting a dental implant put in, and I noticed this gentleman sitting across from me. I never told you this, but all of a sudden he would look at me, and he'd look up over my head, and he'd look back down at me. He would just double check and just make sure that the guy and he was seeing on the TV was the same guy sitting there. But, this is a way that you eliminate the anxiety of the patient. Lord, a person going into a doctor's office and going in there and it's a cancer doctor, and you go in there and you don't know what's going to happen to you. You don't know what's going to be said to you, and you're scared to death. And so many people have feared a dentist. But I have a question of my own, and it's this. With the decline in the necessity for fillings over the years, when I was a kid, why do you think people have so many periodontal and other mouth diseases when we don't seem to have a need to really see a dentist as much, because we don't seem to have cavities?
Yeah, it's interesting. As children, we don't have as many cavities, but as adults, we do. And the types of cavities that we get as adults are more difficult to control than those that we got when we were children. And I got to tell you, the number one thing is, you'll guess it. You know what it is?
What's that?
Sugar.
Sugar. I know. Do you know what? Since Lent started, I have not had a Coke, and my doctor checked me on my physical this week, and I had lost 5 pounds.
Wow.
And if I would give up bread the same as I gave up the Cokes, I probably would have lost a lot more. Yeah. And as much as I hate to admit it, there is a lot of sugar in bread. Yeah, there is, particularly white bread, white flour. It ferments very easily and can do damage not only to the teeth but to the rest of the body. And if you think back in the 1950s, when we were probably consuming somewhere in the order, I think, about 40 pounds of sugar a year, and now some estimates are saying that we're eating about 200 pounds of sugar a year. What a tremendous, tremendous difference in a couple of generations. Take a look around, Lee, when you go to restaurants and you go to other places. Take a look at the people. I know that it's not nice to cast aspersions upon other people, but when I'm paying the medical bills through my taxes, and I think I have a right to say that people need to take better care of themselves.
They do. I mean, you just go to. Remember, we used to go get gasoline, and we go get gasoline at a gas station. There is no such thing as a gas station anymore. Every station is a convenience store, and if you take a look in those refrigerators, what do you see? sugar-containing drinks, and
right.
so we've changed what our what our everyday normal routine is as far as eating and as far as drinking goes, and it's taking a tremendous toll on our health, including periodontal and dental health.
Yep. I'm gonna surprise you, Dave. I'm gonna get in all the questions that you and I talked about before the show. So the last question I want you to talk about, because you sent this to me. You mentioned, what has corporate dentistry done to the practice of dentistry? What did you mean by that?
I'm sorry I wrote the question.
No, I'm not, because I want to know.
Well, if you look at corporate dentistry, and I'm not talking about all corporations, but I'm certainly looking at what I see and what I know from staff members who have worked in corporate dentistry and are working in traditional dental practices now. And that is, in corporate dentistry, profit is what you're doing, what you need in order to be able to make the corporation operate. And therefore, there are certain requirements among doctors and staff to recommend certain procedures on a policy basis for whatever reason. I'm not saying those procedures are necessarily bad. They usually aren't, but we can question whether they're really necessary. And so if there's an incentive to sell a particular service or product within the dental practice, I have some difficulty with that, and that is being done in corporate dentistry, or at least in some corporations.
Well,
and so you've got to be aware of what's going on.
Okay.
What's recommended.
One of the reasons I ask about that is because another thing, and I'll bring it up more after I talk to Bill Johnson, who is the legal guy. But I also noticed one thing on the National Association of Elder Law Attorneys that had to do with talking about reduction of types of care for senior citizens when they go into an emergency room. And they talk to the doctors, and they take a harder look at why that person is coming there in the first place. And that scared the living, out of me, because when you're a senior citizen and they start talking about taking people into emergency rooms and talking things over, the first thing you think about is, it's my life, and if I want to expire now, that's my decision, but it shouldn't be somebody else's.
Right. Yeah.
Yep. So, I think that we need to do a heck of a lot better job of reading what's in those newspapers, and that's one of the problems. Somebody asked me a question the other day. Said, you seem to have a better than average knowledge of medicine, and could I ask you some questions? And I told the person, I said, well, I've been through a lot. And I've got some ideas, and I do a radio and TV show, so I've talked to a lot of doctors. And with that, the person started asking me some questions, and I'll give you a call because I do want to talk to you about it, because part of it amounted to severe, uncontrolled periodontal disease. And I just think that we can do a better job. So you got about 10 seconds, Lee. What would you close with?
10 seconds?
Yeah.
Joe, I love you. I just think you're doing a spectacular job. Look at how Helping Seniors in Brevard County is flourishing. Congratulations and well done.
Damn, but you're the guy to help start it, and I appreciate that. Listeners, I thank you for listening today to Dr. Sheldon and me. I hope you've learned something, and I'll see you next week. No, I won't. Kay will be doing the show because I'll be doing TV tapings. So I'll see you in 2 weeks. Bye-bye.